Good morning and welcome to Access Health. Cervical cancer, as recently as the 1940s, was the #1 cause of cancer death for women of childbearing age in the United States. Currently, it is one of the most preventable cancers due to more specific screening guidelines and innovations in testing. Today, a comprehensive guide for protecting ourselves from cervical cancer. I'm Erica Vetrini. Access Health starts now.
Women cannot just keep dying from cervical cancer. It's completely preventable. There's no reason for this to be taking family members. This is science, and it will not discriminate against anyone. My name is Viselyn Lopez, and I am 32 years old. I have been married now for 8 years to my husband, and we have 2 awesome kids. They're 14 and 8, Jesus and Damien. Those are my boys, my babies. I run a catering company. I'm the owner and operator of it. The name is From Scratch Catering, and I've been doing that for 4 years now. When I was pregnant with my second son, I had the pap smear that comes with the checkup at the beginning of the pregnancy, and they included an HPV test, and I came back positive for HPV, and my pap was abnormal. The doctor told me that he thought I had precancerous cells on my cervix, but because I was pregnant, there was no biopsy that they could do, so we waited it out. After I gave birth, I went back to work and went without my pap for about 4 years. I mean, being busy with work and with a baby, and just, you kind of forget that you didn't do it, and you kind of don't give it the importance that you're supposed to. My symptoms started to kind of kick it up a notch. I had really irregular periods, sometimes twice a month. I had lots of swelling all the time. I had constant infections and just a long list of random things that I was just feeling. I was moody, I was tired, and it took a toll, so that drove me back to the gynecologist to have a pap smear, which came back abnormal. And that pretty much started my journey with cervical cancer and HPV.
Since the advent of the pap smear in the 1940s, the number of cervical cancer deaths have declined significantly due to preventative screening, and the numbers continue to drop approximately 2% a year. New guidelines for cervical cancer screening and many improved testing options have been published, but the lines can be a bit blurry about what to do and when. Here to help us get a clearer view of our prevention protocols is Dr. Douglas P. Malinowski of Becton, Dickenson and Company. Welcome, Doctor.
Good morning, Erica. Pleasure to be here.
I am so happy to have you here.
Thank you.
There's so many questions that need to be answered, but maybe we start from the beginning.
Okay.
Can you help us understand what exactly is cervical cancer?
Sure. Well, as the name implies, it's a cancer that arises in the uterine cervix of a woman. It is comprised of 2 cell types. There's a squamous cell carcinoma, which arises from the outside of the cervix, and then there's an adenocarcinoma, which arises inside the endocervical canal. Both of these cancers can be detected using pap cytology, which is part of a woman's healthcare visit with her healthcare provider in terms of pap cytology.
But the key is you have to go.
The key is you have to go. I think the 2 things that I like to remind people is that A, cervical cancer is a completely preventable disease. In fact, in the United States, the roughly 12,000 cases of cervical cancer are attributed to women who do not participate in cervical disease screening. So the second key point is that a patient should avail themselves to their healthcare provider, whether it be their OBGYN or their family practice clinician, and participate in cervical disease screening. That way you can prevent this disease.
That's a lesson to all of us. So can we quickly also go over the risk factors?
Sure. Well, the primary risk factor in cervical cancer is high-risk human papillomavirus, also known as HPV, which has been shown to be the etiological or the causative agent of cervical cancer in just about every case of cervical cancer which has been characterized.
That's amazing to me. Almost every cervical cancer is caused by HPV.
I mean, there are some rare exceptions where you don't find HPV associated with cervical cancer, but in the vast majority of cases, you can find a high-risk HPV virus that is associated not only with cervical cancer, but with the malignant precursors.
Can you sort of just define what exactly is the HPV?
Sure. It is a relatively small DNA encoding virus, and it infects not only humans, but also infects a wide variety of other species. Most people are familiar with an HPV infection if you've ever had a wart on your hand.
That's HPV.
Or a plantar's wart. Yes, that's caused by a benign form of the virus. One of the common characteristics of all HPV infections is that it causes an abnormal proliferation of the cells. And I think it's important to recognize that there are about 120 different virus strains or so-called genotypes of the human papillomavirus. There's only about 14 of them that are associated with cervical cancer, and it's those 14 that form part of the testing paradigm that's used in the medical community to help aid in the detection of both cervical cancer as well as the malignant precursors.
And that's important for anyone out there who knows somebody or who has HPV. It doesn't mean you're going to get cervical cancer.
Right. A couple of numbers to keep in mind. Of all the women who are infected with HPV, about 90% of those women are actually going to clear the virus. The immune system will clear that virus within 12 to 24 months of the infection. Okay? The remaining 10% of those women, for one reason or another, end up developing a persistent HPV infection, and a subset of those women will ultimately go on to develop cervical cancer.
Well, let's talk about the traditional Pap test that we're all we know most of us are very familiar with.
Yes.
What exactly is that testing for?
Okay, so the Pap test is looking for the presence of malignant cells that were taken from the cervix at the time that the Pap cytology examination, or in some cases are looking for the presence of cervical cancer. Pap cytology is still a very effective test primarily because of its high specificity, its ability to detect these precursor lesions. If they're on the cell and the cytologist can find them, the diagnostic accuracy of finding the precursor lesions is quite high. The problem is that not every cell that's infected with HPV necessarily has these associated morphologic changes that can be examined microscopically. And that's where HPV testing is very valuable because it increases the sensitivity for finding disease. So that the two tests, when used in conjunction, form a very effective screening methodology to look for the presence of cervical cancer as well as the malignant precursors.
And I understand now that there's also new guidelines in place.
Guidelines do not recommend any kind of testing for women younger than age 21. For patients between the ages of 21 and 29 years of age, they should get their Pap cytology test. If the Pap cytology test is normal, no indication of malignancy, then the guidelines say you can go back into the general screening population and you don't need to be retested for 3 more years. The second big change is the inclusion of HPV testing along with cytology for women 30 years and older. That's called the co-test, and that's now part of the guidelines to improve the ability to detect cervical disease.
Thank you, doctor. More about navigating the guidelines for screening after the break, but first, let's check in with Dr. Conlen at Boca Raton's Obstetrics and Gynecology Associates with some of the warning signs of cervical cancer you should not ignore.
Some of the warning signs that you should not ignore would be any form of bleeding or a change in the vaginal discharge. In particular, anything that is different for you. Also, if you have any bleeding after intercourse, or even a strange discharge after intercourse, or an odor, pelvic pain, or any kind of bleeding. And of course, should you have unexplained weight loss, that is a very big tip-off that something is going on, and you should see your physician right away.
My body was just yelling at me that something was wrong.
Welcome back. We've been discussing cervical cancer today and how to know if we're at risk. Like many cancers, the goal here is prevention, and prevention typically means a pap smear by a gynecologist. Statistics show that 75% of women that have yearly screenings will have an abnormal pap smear during their lifetime. Dr. Conlen explains that these results can be quite normal.
So when they call you up and they tell you that they have an abnormal pap smear, it doesn't mean that you have cancer and don't make any long-term plans, because that's just not the way it is. There's a continuum that occurs. It can be anything from inflammation, from an infection. It can be what we call ascus. In other words, it's atypical cells, but they're not sure whether it's normal or truly abnormal. And of course, we want to know if there's an HPV infection. Now, if there's an HPV infection, there's no adequate treatment for it, but we want to follow these patients carefully to make sure that the HPV does not infect the cells and cause the cells on the cervix to become abnormal. So the most important thing is that after you find out that they want to do a follow-up pap smear in 4 to 6 months, don't forget about it. Try and follow what the physician or the physician's nurse tells you to do exactly. And of course, if you have questions and you're scared, certainly call back. No physician's office minds if a patient calls back and wants to have further clarification.
I'm back with Dr. Malinowski, Chief Scientific Officer at Becton, Dickenson and Company. Doctor, we've learned that having an abnormal pap test, while scary, is not uncommon. Actually, it's quite common. So what is the scientific reasoning behind that?
Well, as we talked about before, Erica, HPV virus is the causative agent of cervical cancer. And in the biology of this infection, it will cause changes in the cell shape and appearance. Those are the abnormalities that are often detected with cervical cytology. Finding an abnormal cytology result in any given pap test may not be that significant clinically. It's the follow-up tests and the follow-up procedures that help determine whether this is a transient infection without any real need for concern versus an infection which is likely to remain persistent and which can lead to more serious changes in the cell relating to premalignancy and ultimately cervical cancer.
But even in that case, in the worst case scenario, you still likely have years.
Yes.
to
Again, this
tackle.
is a very slowly progressing disease. It affords multiple opportunities for your gynecologist or your OBGYN to get the results from the laboratory and to make an assessment. Is this a low-grade infection which will likely resolve itself within time, or does it appear to be more of a persistent high-grade infection, which of course needs more serious medical intervention?
So we've sort of discussed how important it is to actually just get the pap test.
Yes.
But I have a question. This pap test has been around for almost a century.
A long time,
Yeah.
yes.
Has there been any innovations? I have to believe that there has.
There have been advances. I'd like to think of them as evolutions in pap testing. So we've migrated away from the use of the conventional pap smear to one which is based upon liquid-based cytology preservatives.
Okay.
This is the LBC preservatives. There are several options that are FDA approved that are available to clinicians and to laboratories to aid in the detection of these cervical and cytologic abnormalities. These improvements result in a more standardized and uniform presentation of cells on the microscope slide, an enrichment of cells on the slide, and the removal of what I would call interfering substances, blood, mucus, inflammatory cells, which sometimes makes it very difficult for the conventional pap smear to allow simple detection of those high-grade precursor cells, which are much more evident in liquid-based cytology preservatives. So that's one advancement. And then the other advancement is the implementation of HPV testing in conjunction with cytology, which helps identify women at increased risk for either incident disease or future disease.
I've been going to my doctor now for years. How do I know if they're following the new guidelines?
Well,
if
the
they're
best-
using
yes.
the liquid-based test.
So your practitioner should be following the new recommended guidelines, but the best way to know is to ask. To ask your healthcare provider if they're following the guidelines, and ask more specific questions. There are many options that are currently available in the guidelines for cervical disease screening, so you should ask your healthcare provider which specific testing they're using and why they're using that option versus the others that are currently available.
So be informed, be proactive.
Be informed and be involved.
Now, when you go in for a pap smear, in most offices and most guidelines, they do HPV testing along with it. But it doesn't hurt to ask and make sure that it is getting done when you have your pap smear. Now, in addition, there is also the vaccine that is starting to be used on a regular basis for both the females and the males.
So now that we're on this subject, vaccines.
Yes.
HPV vaccines have been in the news a lot lately.
Right.
How can you describe the need of vaccine?
Sure,
What can it
absolutely,
do?
absolutely. So remember, cervical cancer is a preventable disease. It is a disease which is caused by human papillomavirus. So if you are vaccinated against the highest risk forms of HPV, you set up the stage for your body to mount a very effective immune response to future HPV infections, and you significantly reduce the ability to get infected. I would recommend that a patient talk to their healthcare provider about whether or not a vaccine is right for them or perhaps right for their children.
After dealing with my symptoms that long, I went back to the doctor and got my pap, and it came back irregular as well. It was abnormal. From then on, it was biopsy, cryotherapy, pap, biopsy, cryotherapy, and I did that quite a few times over. I was kind of just stuck in a rut, in a loop with the same protocol. I think I went through 4 gynecologists. The 5th gynecologist did a leap. I got the results back that I knew were correct. Results came back positive for cancer, and he wanted to schedule me for a hysterectomy. And I was scheduled for surgery 8 days later. Just knowing that I don't have to worry about cervical cancer coming back, that's a relief. That's peace of mind. I can sleep at night knowing that I took care of that I nipped it in the bud.
There are many resources available regarding cervical cancer. In fact, Viselyn has a message for us all.
Women just need to know that they're not alone in what's going on, and it's not that taboo, and there are resources and places where you can go for information and support. When I found the National Cervical Cancer Coalition, they inspired me to maybe do that for the next person, because I found the home with them, and I wanted to be that for the next girl who was out there, looking for answers or looking for someone who could relate. And that it's very gratifying to work with the National Cervical Cancer Coalition. I started my chapter with the National Cervical Cancer Coalition once I realized that there was no other chapter in all of Florida that was active and helping women find the right information. I planned my first event before my surgery, but I didn't actually hold the event until 4 days after surgery. I hosted a brunch for ladies and moms. That was in May, so aimed kind of towards Mother's Day, and I just brought over all the women I knew and fed them brunch and gave them pamphlets and showed them the website and told them what we were doing and what our plans were for the rest of the year. None of these people had actually sat down and spoke to anyone else about having an STD. HPV is considered, and nobody wants to talk about that. Or getting pap smeared. I didn't feel alone anymore in what I was going through. And I felt like maybe having that conversation was gonna get some of those girls at least to go get checked on a regular basis. Maybe, the next time they think of rescheduling, they'll think of, Viselyn had cancer, and they'll go ahead and go.
Thank you, doctors, so much. Such a great show with so much useful information.
Well, thank you, Erica. It was a great pleasure to be here. And I would like to remind our audience once again that cervical cancer and its precursors is a completely preventable disease. So I would encourage the listeners to be involved, be educated, and be informed about their healthcare choices.
Thank you also to Dr. Conlen for the tips, and also to Viselyn for sharing her personal story. For more information on the liquid-based pap test, visit bd.com. In addition, to find a National Coalition for Cervical Cancer support group in your area, you can go to nccc-online.org. And of course, you can log on to our website, accesshealth.tv. See you next time.